My name is Katie. I have von Willebrand's type 2A. My mother has von Willebrand's type 2A, and so does my daughter Adelaide. I thought that I knew everything that there was to know about living with von Willebrand's, drawing upon my mother's life experiences and my own growing up. But it wasn't until my daughter was 5 years old and she experienced multiple life-threatening bleeding episodes did we realize that despite our same diagnosis, could our symptoms display themselves in such varying degrees of severity at different points in our lives. Again, when Adelaide was 5, she had multiple spontaneous bleeds, and it landed us in the ER multiple times over, being admitted, having blood transfusions, getting blood infusions, getting procedures to try to determine the source of the bleeding episodes. It was just a very scary time for us. And it was at this time that her hematologist determined that we should probably start thinking about a more proactive approach to her care. And this is when we started to learn how to infuse at home. Ever since then, our lives have forever been changed for the better. It really forced us to, or pushed us to gain a much deeper understanding of our condition, just gaining better, deeper understanding and confidence. And it really shifted our participation with our care from a more passive role to being partners with our doctors and our care team when it came time for not only my daughter's care, but then inadvertently it impacted my mother and myself as far as how we approached our care. If it wasn't for Adelaide being on prophylaxis, her childhood would look completely different than it does now. We would not have the capacity to say yes to activities that, even if something slight would go wrong, would end up being a life-threatening situation for her. With the ability to have at the ready treatment and our ability to know how to administer that, Adelaide can do things that, again, we would never say yes to before. She plays softball. She's even a catcher for her team. She loves learning how to sail. And even just a simple thing like riding bikes around the neighborhood with her friends are not panic-inducing like they were to me before. Having Adelaide on prophylaxis and learning how to infuse at home inadvertently impacted my mother's and my own life as well. In the past, before there was Humate P and other factor products and other treatment options, we were very apprehensive to seek out care until it first became a life-threatening situation. The ability for all three of us to take a more proactive approach to our care has been absolutely invaluable. It's quite literally been a positive domino effect in our lives. As our confidence and understanding about our condition grows, it's really given us the ability to speak up for and ask for care well before it becomes out of control or too late. Because as we all know in the bleeding community that time is very important when you're having a bleeding episode. Incidentally, because of the knowledge and experiences that we've had, we've been able to avoid multiple hospital visits. We can proceed with procedures, outpatient procedures that we never have been able to before. I've been able to infuse myself at home with the confidence of from my daughter, her coaching me along. She even infuses herself and has become an amazing advocate for herself, which is going to be invaluable for her in the future for her own care. It's literally transformed our lives.